Dehydration significantly amplifies the body's stress response. A recent study reveals, if you're not drinking enough water, your body might be reacting more intensely to everyday stressors than necessary. According to the research, individuals who consistently consume less water exhibit a heightened biological reaction to stress, characterized by elevated levels of cortisol, the primary stress hormone, compared to those who meet the recommended daily fluid intake. Interestingly, these individuals do not report feeling thirstier than their well-hydrated counterparts. But here's where it gets controversial. Some might argue that the amount of water we drink shouldn't affect our stress levels, but this study challenges that notion. The research, conducted by experts at Liverpool John Moores University, LJMU, involved 32 participants divided into two groups, those who drank less than 1.5 liters of water daily, and those who met the European Food Safety Authority, EFSA guidelines of 2.5 liters for men and 2 liters for women. In the UK, the Eat Well Guide recommends a fluid intake of about 1.5 to 2 liters per day, equivalent to 6 to 8 cups. However, factors like heat, physical activity, illness, pregnancy, and breastfeeding can increase the need for hydration. To test the impact of hydration on stress, researchers monitored the participants' hydration levels over a week using urine and blood samples. They then subjected the participants to a simulated job interview and a mental arithmetic challenge, both designed to induce stress. The job interview required participants to prepare a speech and present it to a panel of people in white coats, while the arithmetic task involved rapid subtraction. Professor Neil Walsh from the LJMU School of Sport and Exercise Sciences described the tests as really flustering. He explained, "We know that people who don't meet the daily fluid intake recommendations are often poorly hydrated. But what we didn't know was whether they would have a more pronounced stress hormone response under controlled conditions." Saliva samples were collected before and after the stress tests to measure cortisol levels. The results showed that those who drank less water had significantly higher cortisol levels, even though they reported similar feelings of anxiety and physical stress responses, such as increased heart rate and sweaty palms, as the well-hydrated group. And this is the part most people miss. The study highlights that the body's stress response is not just about how you feel, but also about the biochemical changes happening inside you. Professor Walsh emphasized, exaggerated cortisol reactivity to stress is linked to a higher risk of heart disease, diabetes, and depression. Keeping a water bottle handy during stressful times could be a simple yet effective way to support your long-term health. While the findings are compelling, Professor Walsh acknowledges the need for further research to explore whether increasing water intake can mitigate daily stressors like traffic jams or work presentations. He suggests meeting the water intake guidelines could be one of several strategies to manage stress and reduce cortisol spikes throughout the day. What do you think? Do you believe that staying hydrated can help manage stress, or do you think other factors play a more significant role? Share your thoughts in the comments below.